I sometimes joke that I have a pill for every ill. In this video, I'm going to share with you my preferred agents when treating depression and anxiety. Don't turn away, because that starts right now. Howdy! Thanks for learning about MS with me, Aaron Boster. I'm the founder of the Boster Center for Multiple Sclerosis, where we care for families impacted by MS from around the globe. I got a great question today from viewer Jenny Chapman, who writes, Dr. Boster, stress, anxiety, depression meds, what would you recommend to your patients? Something that wouldn't cause sleepiness or weight gain. Would Lexapro be a good choice? And what are the pros and cons of stopping after a short while versus taking it for a few years? Great set of questions. Treating depression is super important, keeping in mind that people impacted by MS are twice as likely to experience depression compared to the general population. Now, there are a lot of antidepressants out there, and every doc probably has a few favorites. My absolute favorite, all things considered, is Wellbutrin. It's an atypical antidepressant, so it's not in the common SSRI or SNRI class. It's kind of in a class of its own, and it is activating. It kind of lifts you up a little bit, so you can't take it at night. You take it in the morning. Now, most of my patients struggle with fatigue, and so an activating antidepressant is not a bad thing. It also promotes weight loss, not weight gain. Many antidepressants have a side effect of promoting weight gain, which no patient of mine has ever thought was a good idea. And so the fact that Wellbutrin seems to curb the appetite a little bit or promotes weight loss is a nice side effect. Also, Wellbutrin does not impair sexual function, and that's very important to me. If I gave you a medicine for depression and it made it so that you couldn't enjoy sex, that might make you a lot more depressed. Also, the medicine Wellbutrin is used to help people quit smoking, separate from mood benefits. And you know how I feel about smoking in the setting of MS. So the fact that there's an antidepressant that may help a smoker be able to overcome smoking and quit smoking is an added extra benefit, a really significant one in my opinion. And so for these reasons, I really like using Wellbutrin. I also like it because I can then augment its effects by adding low doses of other medicines, like Zoloft. So Zoloft is a traditional SSRI, and I can add a very low dose to Wellbutrin, and in many patients, I feel like I get a synergistic boost. Now, Wellbutrin has a set of side effects that we always have to think about. So if you have a seizure disorder, Wellbutrin's a no-no. And in fact, if you've ever had a seizure, then that's not a medicine we would reach for. Also, rarely, Wellbutrin can worsen anxiety, and so we kind of have to keep that in mind. Wellbutrin's not the only antidepressant I use. You mentioned Lexapro, and Lexapro is another very well-tolerated medicine. I like it very much. I also, as I mentioned earlier, like using Zoloft. So these are three medicines that I reach for often. They're not the only antidepressants that I use, but they're probably the top three in mind when I'm working with folks in my clinic. Now, the next question you asked is a super important one. What happens if I take the antidepressant for a short period of time versus a long period of time? And there's some really solid data out there, and it really helps inform the answer to that question. It can take 6 weeks for an antidepressant to start working. They don't work quickly. And so if you're prescribed an antidepressant, I sort of need you to agree in your mind that you're gonna try it for at least a month, if not 2 months, before we decide if it's working. Oftentimes, if you take a medicine for a week and it's not working, you wanna stop it. But here's a situation where we need to give it more time for it to kick in. Once it kicks in and you notice that it's working, it really is in our best interest that we stay on the medicine for a minimum of 6 months. If you stop the antidepressant in under 6 months, there's a high likelihood of a rebound depression. So, when I'm talking to someone about starting an antidepressant, I like to review those things with them. It's best to try it out for a month or two, barring side effects. And if you find that it's helping, and we need to stay on it for a period of at least 6 months. I also want to use this video to make a couple comments about anxiety, because anxiety is also super common in the setting of MS. And it's been my experience during this global viral pandemic of COVID-19, anxiety levels have skyrocketed. And so there's a lot of behavioral interventions that we do, but there's also a lot of medicines. And since this video is discussing specific medicines, I figure we'll include a discussion on the medicines I like when managing anxiety. I don't like using benzodiazepines, so Valium, Klonopin, Xanax. Those medicines can help with acute anxiety, but there's an abuse potential and there's a tolerance, and they're really hard to come off of. And so I don't reach for them. Moreover, if you have an acute moment of serious anxiety and you're at work or you're driving, you can't take one of those medicines very easily because it's going to cloud the sensorium or make you sleepy. So one of the medicines that I'm super fond of is a medicine called Buspar. And Buspar is a medicine that can help with anxiety. It's very interesting because you can schedule it 2 or 3 times a day. So you can take Buspar at set times, or you can take Buspar as needed for acute bouts of anxiety. So you're starting to get really, really anxious, boop. But it's not a benzo. It doesn't make you groggy and sleepy. It doesn't cloud the sensorium. And so I like Buspar for that reason very, very well. And I've had good success in adding Buspar on top of the medicines I described at the beginning of this video. If you have more questions about managing depression and anxiety and multiple sclerosis, I want you to check out the playlist that's on the screen right now. Oh yeah, and by the way, let's go check out my chickens.